Hello, I'm Pete Nenny, a representative of the Daily Herald editorial board. Today is September the 10th, and we're pleased to begin a joint interview with candidates for Lake County Coroner in the November 2020 election. We welcome the candidates, incumbent Dr. Howard Cooper and his Democratic opponent, Jennifer Banek. Dr. Cooper will begin our questioning with you. What differentiates you from your opponent?
Well, I think first and foremost, I'm a doctor. Other than that, I have a very extensive background in forensics. I've been involved in forensics for over 30 years. When 9/11, right after 9/11 happened, that day I was called upon to go to New York. I was flown there by the Air Force on the 12th and worked at Ground Zero for a number of weeks. In addition, I'm on two federal teams, or was on two federal teams. One I'm still on, the Disaster Mortuary Operational Response Team, and I was also on the Weapons of Mass Destruction All Hazards Team for 16 years. With that team, I also went to New Orleans after Hurricane Katrina and worked down there for 5 weeks doing body recovery and decontamination, as well as dental identification. So I have a very extensive background in the area of forensics and in investigation.
Ms. Banek, same question.
Thank you. So yes, my name is Jennifer Banek. I am the Democratic candidate for Lake County Coroner. I am a CRNA, certified registered nurse anesthetist or nurse anesthesiologist. And just to clarify, Dr. Cooper is a doctor of dental science, which is different than an MD, which is a medical doctor. So I am an advanced practice nurse. I have had extensive training in anatomy and physiology and pharmacology. I've been practicing as a nurse since 2005 when I was a bedside nurse, and in 2012 I became a nurse anesthesiologist. In terms of my community service, I have a long-standing history of service and dedication to my community. I currently serve as a trustee on the Cook and Aspen Library Board. I also serve as a mentor for a local organization called Community Bound Operations, and it's for youth in the area that are it's College Bound Opportunities. Youth in the area that are will likely be the first in their family to attend college. So I also have a history of longstanding service to my country. I am a service member in the United States Army Reserves. I currently hold the rank of captain. Most recently, I served on a damage control surgical team in Qatar over in the Middle East, returning this past January. So, you know, as being having a background in nursing and medical expertise, advocacy has been something that I have a long history of doing, and that's what I plan to bring to the coroner's office, advocating for Lake County residents.
Ms. Banek, how would you describe yourself? I'm sorry, Dr. Cooper.
Just want to say my degree is actually Doctor of Dental Surgery, just so it's correct.
Okay. Great, thank you.
Ms. Banek, how would you describe yourself to voters? Why should people vote for you?
Well, again, drawing attention to community service, I also think that fiscal accountability and transparency is very important. Recently, there was a request by the incumbent coroner for a pay increase. I believe that was in April of this year. At that point, Lake County had 14% unemployment rates. That was something that if I were the coroner at that time, I simply think it's not the time for public servants to be expecting a pay increase. I also think that, you know, reporting to the county board is a nonpartisan issue. And I think that Chair Hart has requested to have monthly reports regarding how, you know, the money is being spent in the coroner's office, and of course any unusual statistical trends. So those are reasons why I think Lake County residents should vote for me.
Dr. Cooper, same question.
Sure. First and foremost, I just want to talk a little bit about what Jennifer had said. One thing is we actually, I don't think she really understands the process. We actually did not go, and I certainly didn't go to the board asking for a raise. The process is that the way that it works is the board actually determines your salary X amount of months before the election. That's the way the law works. So it's not that we actually went to, because there were two other countywides that were up for this process. So it's not that we went to the board actually, that they have to rule on that. And I'm not going to go into the long and detail of it, but it's not that we went to the county board and asked for a raise, because that's not what happened at all. That's just the process that has to be taken by the board, by the law, state of Illinois. As far as why people should vote for me, I certainly have a track record. I'm, very compassionate. I've been treating patients for 29 years in Lake County. We've changed the office. When I ran last time, I said, there were certain things that I wanted to do with the office. I wanted the office to become accredited. We did that. I wanted the deputies to become boarded in the big society that the American Legal Board, the American Board of Medical Legal Death Investigation. We've done that. All my deputies have been boarded, with the exception of 2, which are board eligible and should have taken the test already, but COVID put things a little bit behind. So we'll have all our deputies boarded, which I think is really a feather in the cap of the office. Our accreditation was a huge process that we went through. That's certainly the first time the coroner's office has been accredited. We were the second office in Illinois to become accredited, one of 26 in the country. So it's, definitely something that I'm really proud of. And I think that it's something that our voters should be proud of. In addition, we've done a lot of community outreach. I said that I was going to do community outreach, and I did. We talked to lots of kids, lots of schools. I talked to them about certainly our opioid issues in the county. I also talked to them about making good choices. And I think that, when people go to vote, they should look at the track record of the people that are running. In addition, I'm the first coroner since 2004 to bring annual reports back, and we have an annual report 2017, 2018, and 2019. As far as the other thing that we've done to make the office more transparent is we brought back inquests. I'm the first coroner to have an inquest in this county since 2006. And I think that that really makes things more transparent, where people really understand what the process is in determining cause and manner of death. So I think all those reasons, are good ones.
Mr. Nenny,
Yes,
may I respond to something?
of course.
Actually, I do understand how the pay increase goes, and I do understand that several months before the election that is evaluated. I was actually listening to that FNA meeting when that conversation or discussion happened, and actually there was commentary about family size and paying for college. I simply don't think that that's the responsibility of voters. And regarding, I appreciate and understand that the raise wasn't going to take effect immediately. My feeling, though, is that we are in unprecedented times that are very unpredictable, and folks in the scientific community are expecting a second wave. So I certainly don't think that a pay increase is something that we should be considering now. Also, in light of the fact that it's possible we might have to furlough county employees. So definitely a concern of mine. And again, just wanted to clarify that I do understand that process. I wanted to, one of my concerns, if you go to the coroner's website, or last I checked, there were a little difficult to navigate. I saw 2 years worth of data, 2015 and 2018, took a look at other end of year reports from different counties, which were voluminous, 16 pages, I think, when I looked at DuPage County. We are the next county size-wise under DuPage County, and it looked like our end of year report was reduced to a one-page Excel spreadsheet. So, my goal as coroner, as I mentioned, advocacy is very important to me. My goal is obviously death investigations and ruling cause of death. I don't want to see you as a statistic in the coroner's office. So that's why I'm an advocate for connecting Lake County residents with resources like dependency issues and things like that that have increased 100% since the pandemic has hit.
Dr. Cooper, my understanding is that you don't control your own website, that it's a county-wide website and the county controls all the various offices and departments within that, correct?
That is correct. And actually our 2019 annual report is 54 pages.
Okay, Dr. Cooper, what's the greatest need facing the coroner's office, and what specific project or plan will you advocate to address that issue?
Well, the greatest need right now is really a new facility. That's something that we've been working on with the county for the last couple of years. Our office has gotten much, much busier. This is actually the busiest that the coroner's office has ever been in the history of our county. Obviously, some of that is COVID related, but not so much COVID death related, but really just the other effects of COVID, whether it be depression or drug use. We're seeing a very high increase in our volume right now. Certainly that's something that we're working on with the mental health professionals and other medical professionals in the county. But it's certainly a big thing that we worry about. The other thing is that with the new facility, we'll be able to have a much better area to work with families. Right now, if a family comes in to view their loved one, the facility that we have for viewing is really horrible. It's not anything that I enjoy, working with people in that situation, because it's just not a good place to see their loved one. And that's something that I really think that we have to do better. Unfortunately, it comes with a lot of expense to putting together a new building. So that's where we're trying to come up with something that we can do that's going to work out good for the county and work out good for the citizens of this county.
What's the status of those discussions right now? Where do you stand in the plan?
It looks like we're certainly on the list of getting a new building, but that was right before COVID hit. So now we're going to have to see where we all fall within that. Certainly COVID, we've had to do a number of things in our building to try and make it safer for our employees and safer for people coming in to talk to us. So we've done steps to do that. I don't know if you've ever been by our office, but you'll see that we have a refrigerated trailer that we put everybody through. We actually COVID test everybody that comes through our building. And that's for autopsies have to be done a little bit differently when there's somebody that's COVID positive. So we do need to know that information. That does not mean that just because they're COVID positive, it's a COVID death. So, a facility, having a trailer in the middle of an alley isn't ideal. Certainly with a new building, we'd be able to have areas where there are trailers that are a lot better than in an alleyway. The other thing that we need in the office is when we're bringing decedents into our office, and then when we're releasing to funeral homes. Right now we're doing it in an alleyway. And that's, it's terrible. It should never have been designed that way, but that's the way it is. We really need a sally port. So there's a number of things that we need in our facility. The other thing we need is, we certainly need more folks to work in our office. And that's something that we've been working with the county as well. And, obviously we are cognizant of, budget and budget constraints. But it is something that in the future, we are absolutely going to have to work with the county on, hoping to get some new deputies. We put together a pandemic plan when I took office, and we also put together a mass disaster plan. And the pandemic plan we've been using, and there is some stuff that we would, like with a new building, that it'll be a lot better for us using both of those plans as well.
Ms. Banek, same question.
Repeat the question one more time, just to make sure I have everything.
Sure. What do you see as the greatest need facing the coroner's office, and what specific project or plan would you advocate to address that issue?
Yeah, thanks. So I have heard about the concerns regarding the building, from multiple board members. So certainly something that's on my radar as well. You mentioned the website being controlled by the county. That might be the status quo. I would advocate to have a stronger hand in that, because how are Lake County residents supposed to make decisions regarding their loved ones if they don't have access to the information? So updating the website procedure would be definitely something that's on my radar. And regarding the 54-page report, that's great. It sounds like you did a really thorough job. As a Lake County resident, I'd like to be able to access that information. It's my feeling that Lake County community members shouldn't have to FOIA information like that from the coroner's office. So the website and definitely the building. I'd address any staffing issues, when I have boots on the ground and can see what's the status is of the office.
Dr. Cooper, do you have to FOIA the annual report?
No, absolutely not. I know that the county is going to be putting it up. I have already spoken with the website designer, and no, we have people calling us for statistics almost daily. Our office takes over 54,000 phone calls a year. Now, obviously, a lot of those are cases and case related and family related, but we certainly get calls all the time for statistics, for anything and everything that we do. That information does not have to be FOIA'd. I'm sure you can talk to your reporters. All the reporters have my cell phone. They call me any time of the day or night. I answer. I give them whatever information that they need. So there's no secrets in our office, certainly, and we report all of our statistics to different groups, whenever they need them. So there's really no issue.
Okay. Let's see. Dr. Ms. Banek, what is your plan to run the office with potential staff reductions that may be needed because of the pandemic? How does the uncertainty of what may happen down the line factor into how you would run the office?
Yeah, lots of uncertainty. So, transition, I expect, at least for the first 60 days, for me to sit with the folks in the office. As somebody in a leadership position, I would sit with the folks. I believe there's a staff of 12 to 13 people that are there right now. Sit with the people that are working there and see what a day looks like for them, and evaluate and assess what kind of hours people are working. Again, as a leader, I wouldn't expect anybody to do anything that I couldn't do or wouldn't do. So I see that as a for the first 30 to 60 days. I think evaluation takes, like I said, for the first 30 days, evaluate and assess, start maybe talking to folks in the office about anything that needs to be changed, problems, and alternative plans if that's necessary. And maybe everything is great and nothing needs to be changed. I don't know. And like I said, until I have boots on the ground, I need to evaluate that.
Are there certain things that going in because of the pandemic that you would want to change?
Well, that there are concerns regarding staffing, what Dr. Cooper mentioned. I have heard that there are, the folks there are working a lot of hours. So that's, definitely something that needs to be taken into consideration. COVID fatigue is going to become, very real if it's not already set into place. So I think we need to take care of our workers and make sure that they are not, being overworked and undercompensated. So definitely, we need to take that into consideration. When people are overworked and undercompensated, especially in times like these with the pandemic, errors are made, certainly unintentionally, but we need to keep people safe. And certainly folks within the coroner's office with a pandemic virus are at a high risk.
Dr. Cooper, same question. What's your plan to run the office with potential staff reductions that may be needed because of the pandemic? How does the uncertainty of what may happen down the line factor into how you run the office?
Sure. So our office is a union office. So the county really can't come in and take away the union or take away our employees. So we couldn't really go down in staff. But certainly, I mean, we work with the county. We did decrease our budget. We came in really, they were very surprised that we could decrease what we decreased. We're hoping that that's going to work and be enough. I really don't know. I mean, that's, none of us know exactly what's going to happen with the county and how much money they're going to be able to recoup with federal funding and with, with the way things are going to be. We don't know what the future holds. So it's certainly something that we look at. Obviously, we're not going into this budget season asking for more full-time deputies because we are aware of the issues with the county, and we know that there are budget constraints. So we certainly want to we want to work well with the county, of course, but the reality is in our office that, like I said earlier, our office has never been busier. We're up over 700 deaths from where we were last year. So our deputies, that equates to almost 80 cases for each deputy increase. That's a lot. That's a lot of work. And, we certainly need to make sure that our folks stay safe. But the good thing is that our folks are incredibly dedicated. It doesn't matter what happens. When this pandemic started, we made sure that we tailored our pandemic plan. We made sure that, it went out to all the firefighters, police officers, funeral directors, long-term care facilities, hospitals, and really, made sure that everybody understood what we needed, what they needed from us. And then we made sure that all the people that work with our office got things that they needed, got PPE, body bags, everything that was needed. We've had requests from hospitals. We had requests from fire departments, police departments. I mean, we handled everything. So my folks step up. When there's an emergency, when something comes up, whether it be a pandemic or if we have a mass disaster, I'm not worried about the people in my office. Everybody there is going to step up and do what they need to do.
Okay. Of those 700 deaths, additional deaths, what's the percentage that's COVID related?
Well, so I can't really give you a number like that because this is our reality. So we've had about a little over 450 COVID deaths in the county. But if we look at our increases, because we've had increases in suicides, we've had increases in overdose deaths, we've also had increases in natural deaths where you have people that are older that aren't feeling well, that instead of going to the doctor or the hospital when they're not feeling well, they're so afraid of COVID that they stay home and then they pass away. So is it that we have, all 700 are, you want to consider COVID deaths? I can't say that they are. But certainly, COVID is an issue with a lot of our deaths.
That kind of leads me to the next question here. What are the latest death trends in Lake County for COVID, and what should be addressed to prevent future losses?
Are you asking me?
Yes.
Okay. Certainly our trend now is the death toll is definitely going down. I mean, we've been decreasing for a while now. At the very beginning, our numbers were just going up and up and up. But now it's been obviously way better. You have to remember that 68% of our deaths are coming out of long-term care facilities. So, that's definitely something that, and I've talked to a number of long-term care facilities, when everybody can sit down, we do want to sit down and go over, what steps can be taken in the future so that this virus doesn't run rampant through facilities. There's clearly an issue with some of these facilities, whether it be PPE or whether it be just their overall, sterility of the center. I don't know. Those are things that we need to sit down and try and figure out what really happened. Because again, that's a very high percentage of our death rate is coming out of long-term care. So that's something that we, for sure need to sit down. And like I said, we've taken steps to sit down with those folks, and we are going to have meetings and go through that so that this doesn't happen again. Because the reality is, at some point, there's going to be another pandemic, and we need to be more prepared in our county.
Ms. Banek, do you have a thought on that death trend and what you would do to prevent future losses?
Yes, I agree with Howard in terms of connecting with the assisted living facilities, and so essentially identifying the high-risk demographics that are contributing to the death trend, and determining, is it a problem with resourcing? Is it a problem with misunderstandings with staff? I think that improved messaging, potentially, I've found that a little frustrating myself as we've been, going through the pandemic. So collaborating with the Department of Public Health in terms of improved messaging for folks in those vulnerable populations. Obviously we're going to be, maybe even partnering with the school systems and talking to school boards as we're continue to have these discussions about in-person versus e-learning. I know folks are eager to get back into school, but obviously that potentially, could increase our spread at some point.
Okay. Ms. Banek, this question's for you. For both of you, really, but you're first. In your questionnaires, both of you talked about the importance of death prevention. There are many areas of concern, including drug abuse, suicides, texting, and driving. While they're all important, which would you target as the most critical need in the next year, and how would you go after it as coroner?
Well, I think, since the beginning of the year, my understanding is that narcotic overdoses and suicides have increased to 100% right here in Lake County. So I think, the best strategy is to identify, what we're noticing the highest amount of. And then, things that would interest me in terms of those causes of death, specifically what demographic is experiencing that. I think sometimes we have preconceived notions or stereotypes about what folks are potentially having dependency issues or narcotic overdoses. I had a dear friend last year who is also a nurse anesthesiologist, turned 50 last year, and was nursing a shoulder injury from an old sports injury and ended up overdosing. I think this is not necessarily the typical picture of what folks see, but I think that something like that involves partnering with other physicians in the area, pain specialists as well, and taking a look at how those medications are prescribed. And like I said, really identifying what populations are specifically experiencing narcotic overdoses and suicides. The Illinois Department of Public Health, I believe the initiative was to reduce narcotic overdoses by 33%. And unfortunately, nobody expected this pandemic. So here we are. And I think we need to, that's definitely on my radar.
Dr. Cooper.
Sure.
Same question?
Well, the good news is our suicides and our overdoses have not increased by 100%. So that's good. I'd be very, very alarmed if they had.
What about the ProPublica article that you were interviewed for?
Pardon me?
There was a ProPublica article that you were interviewed for earlier on in this year.
I didn't say that we've had, at no point have I said that we had a 100% increase. So I don't know where you're getting that, but I know we have.
I stand corrected. Yep.
I'm aware of our numbers. But I think, first and foremost, yes. I mean, I get into a lot of the schools. We have lots of groups that come through. We do Zoom tours. We do, I do PowerPoints. My big thing, it's not just, I talk to the kids about overdoses. I talk to them about opioids because we do see a big trend in that area. But we also see suicides, and we also, I talk to kids about just making good choices. And, there's a lot of death that we see in our youth that's not just one or the other. I mean, we see death in our youth all across the board. So I would really not want to say we just want to go and target one area. I think all these areas need to be targeted. And that's what we do. When we talk to kids, we talk to them about all these different things and make them understand, or try to make them understand, that they need to make good choices. And so they don't, end up in our office on a table. That's certainly not what we want. So, I've talked about death prevention when I ran last time. We've done it. I mean, like I said, I talked to Explorer groups, Boy Scouts, Girl Scouts. We also talk to a lot of other groups. We talk to, adult groups. It's not just about kids, because our overdose numbers and our suicides are really all across the board. I mean, we have people that are in their 80s that can, commit suicide or overdose. So it's not just a young person thing. So we talk to a lot of different groups. And I've even gone over to some homes where we can talk to folks there, elderly population. So we really try to get out to everybody. And I just think that, we'll certainly continue that because that's, again, that's when I ran the first time, and I'll say it again, death prevention is a priority for me. We want to make the office less busy because we want people to live, and that's really important to us.
This next question is for you. Do you have other more creative ideas for reaching out and engaging the community on these issues, on these death prevention issues?
Yeah, I mean, I think, certainly we're going to look at, especially now with Zoom, we're going to look at having a lot more of these types of things where people can come in and get online and talk to us, or we can give lectures, or we can give talks. That's definitely something that we're going to be doing. I've already in the process of doing some coffee with the coroner. And I think that's going to probably be the way to go for right now, because we're not going to be able to sit and be in a large group like we used to. Certainly we can't have tours at the office right now, so we're going to be doing everything virtual. But this summer I did a nice presentation for a forensics class that was all set up on Zoom already, and they asked if we could present. It's a group that does come to our office normally, so that worked out great. And I think that's what we're going to be doing, is more PowerPoint presentations, because we won't be able to have them physically in our space. So we'll be able to, they'll be able to see video, they'll be able to see PowerPoint presentations. So I think that's really the wave of the future. I think that's just how it's going to be. At some point, obviously, we would love to get folks back in and have classrooms. And even in our new building, the building that we've designed, we do want to even have classrooms where they could come in and we can, educate them on a lot of other topics as well. So we'll just, right now, we just have to sort of see how everything goes, but that's what we're looking at currently.
Ms. Banek?
I think working with high schools, local high schools, partnering with resource centers for youth that are, interested in exploring more information regarding forensic science, and, but really building partnerships. Sometimes it's through those initial, like I said, building of partnerships that then, you're able to establish trust with other stakeholders within the community. So I think definitely partnering with young folks here in Lake County is really important, and something that I'm, accustomed to doing. Also, as a healthcare provider, if they're not interested in forensic science, certainly I have a vast network of folks, that I can connect them with. And like I said, really, that's more about building trust and relationship building. I also think speaking with, hospitals in the area and physicians, and that goes along with the opioid epidemic, and partnering with those folks and having discussions about what they're seeing, and certainly assisted living facilities, and seeing where we can work with them in prevention of preventable deaths.
Ms. Banek, in July, the Daily Herald reported opioid overdose deaths could reach record levels this year in Cook Lake and DuPage counties, as the COVID-19 pandemic adds several factors that contribute to drug-related fatalities. What would you do to address this if you were coroner?
Yeah, that's a great question. So I think, a couple of things, especially, contribute to this is that many folks are experiencing significant financial challenges, which might precipitate relapse if they've had dependency issues before. In addition, we're advocating for social distancing, so the administration of Narcan becomes much more challenging. I think that facilitating peer assistance, with access to folks who can, mentor and work with people who've had dependency issues, and really advocating that information to community members so that they know that it's available to them. And, you know, working with other people in the public health department to increase, number one, the accessibility to 24-hour assistance, and number two, getting that message out to Lake County residents.
Dr. Cooper, what is your office doing to address this?
Yeah, well, right now, I mean, certainly it is an issue. There's no question. We've been talking about it, you know, all over. And I was interviewed in that article. And, you know, I'm on the board of the Lake County Opioid Initiative. We sit down and look at the resources throughout the county. We're trying to do everything we can to help. Right now, we're currently looking at purchasing a building, which a way out will be able to house them. And, you know, a way out is a program that, you know, makes it accessible for folks to get help at any police department in our county. That's something that, you know, is very important, especially now because we need to have resources. Live for Lolly is also a great resource for us, NACASA, Gateway, and these are groups that we work with all the time to try and figure out where can we go, what can we do, how can we address this. Live for Lolly, you know, has set up their van. We talk to them all the time about our numbers and about where we're seeing increases so that they know where to go and talk to folks about using drugs and about treatment and things like that. And so that's a really good resource for us. But really it's just getting in the community, and it's working with all the folks, all the mental health professionals, all the people that, you know, I mean, obviously our office can't spearhead any of these things because we don't have the funding or the resources to run these programs, but we're involved with these groups that do, and that's a really important thing. And we certainly have a seat at that table. And, you know, working with our state's attorney's office, working with all the police departments to try and help, you know, everybody get the help that they need during this time.
Miss Banek, some county board finance committee members have asked for monthly reports regarding deaths. What do you plan to do to make the county board more aware of trends in the office is dealing with so that they can best allocate resources?
Did you ask me? I'm sorry,
Yes.
Okay, sorry. Well, I mean, I absolutely think that it's important for the coroner to be present at these meetings, you know, to submit detailed reports so that the county board members know how this money is being spent. You know, this is something that's not required of the coroner, but certainly it's you know, something that a public servant should do, in my opinion. And like I said, that should, in my opinion, have bipartisan support. That's not a Democratic or Republican value of fiscal transparency. So I think monthly reports and being present at these meetings and being a voice for the coroner's office.
Dr. Cooper, what are your thoughts regarding being present for those meetings and submitting monthly reports?
Well, working with the board is very interesting. I've actually, after the last budget round, which was last October, I realized, you know, very quickly that what the questions that the board was asking, they really didn't understand exactly what we do. And I've been asking the county board to be able to address that and to speak with them about our office and explain to them exactly what they do so they could better understand. And now we're in September, so 11 months later, I have still not gotten a chance to talk to them about our office. Not because I have not wanted to, but because they will not allow me to. So while we talk about, you know, it should be bipartisan, and I totally agree, I think it's very frustrating for me not being able to address the county board at some point. I was supposed to actually talk to the L&J committee last week. I had been on their calendar for 6 weeks. I had been waiting to go over our 2019 annual report and talk to them about different trends that we're seeing right now. And 2 business days prior, I was told that I'm not allowed to give the report. So, it's been very frustrating. Now, the problem with monthly reports, which I've tried to explain, but again, it makes it difficult when you can't address the entire board. Monthly reports don't tell you anything. The problem with monthly reports is that there's so much information that I can't give because we have cases pending. The reason that we give annual reports is because in an annual report, you can see an entire year, so you can compare a finite set of time and you can make an actual comparison. The problem is if I give you, like right now, if I tell you that we have 5 homicides this year, the problem is that I have 181 cases that are pending. So that number 5 doesn't mean anything. It's a number, yes. It's a number that tells us how many we've closed and where we're at that particular day. Is it a real number? No, because I have 181 cases pending. So that number, all our numbers are going to change. Now, we give our statistics to groups that need them because they're looking at it from a different point of view. But they're not looking at, first of all, the groups that we do, which is LCOI and our suicide numbers, they totally understand the fact that we have cases that are pending. They're just trying to get an idea of where we're at for the year. But these groups study this information and understand what those numbers mean. I would love to get a chance to speak with our board. It's been very frustrating. I've asked our county board chair, I've asked our committee chairs, I've asked the county administrator, the deputy county administrator. So it's very frustrating for me. I understand it's politics and I get that. But from my point of view, I'd love to be able to share more information. I've begged. We had on 3 different occasions last summer, I asked the L&J committee to come to my office for a tour so we can explain some stuff there. That meeting kept getting canceled by them. And then the day that 6 people were supposed to come, only 1 showed up. So it's very frustrating from my end because I do want people to understand where we're coming from. And while I understand that people want to say that we're not transparent, we're not giving anybody the information, again, I'm the first coroner to give an annual report since 2004. We have that information. We give our information to everybody. The health department calls me all the time. Lots of different organizations call me for data. We track lots of different things. Police departments have asked me for things. We don't say no to anybody. So now, as far as the county board, yes, we can give an annual report, a monthly report, but that report is a meaningless report. And what the amount of time that it takes for us to put some of those together is, unfortunately, it takes out of a deputy's time to do what already they're completely overworked. My main concern is really the public. We need to get our cases done, make sure we have good investigations that are done perfectly, make sure we know why somebody died, work with the families, give them the information. That's what's important. An annual report is where we see trends, no doubt about it. And the board has that information. So I think that's great. I've talked to our county administrator again yesterday about the information that they want. We still haven't even gotten exactly what they want. I know they keep telling me, about certain reports, but they haven't even given me these specifics.
Dr. Cooper and then Ms. Banek, are there areas though where transparency could be improved that you would like to improve?
I think we've been running really, if you look at our budget is approved by, the county board. So it's completely transparent. They can see what we spend on any given time. So there's nothing there that I think is non-transparent. They approve everything we do as far as money. When it comes to our investigations, I think that we run independent investigations. All the information is available once cases are closed. Certainly while we're in the middle of an investigation, we're not going to release any information. But once an investigation is closed, for families, they get information anytime they want. For other people, they do have to go through FOIA because we're a public office and that's how it works. But everything is FOIAble, so there's really no issue. As far as increasing transparency, I think we've done that. I think with all of our officer-involved deaths and our in-custody deaths, I'm the first coroner since 2006-7 inquest. We bring all those cases to a jury. We want them to hear what happened. We want the families to hear what happened. Inquests are a very interesting thing because it's not just that a jury is hearing everything from lawyers. The jury is hearing it from the people that actually investigated the case, the doctors. The interesting thing about that is that the jury can actually ask the people testifying questions. So, they can ask whatever they want to ask and they're going to get that information. They see pictures, they can see videos. Everything is given to them so they can rule on the case. I think that makes everything very transparent. So I think we've done a great job at increasing our transparency in our office. And we'll certainly continue, but I don't think there's anything else we can do. I think everything is accessible by either the public or by FOIA if necessary, or during our inquests, which our inquests are also open to the public so people can sit in and listen.
Ms. Banek, do you have any ideas that you would use to increase transparency?
So I'm not a fan of creating unnecessary paperwork myself. Certainly, I think that there are things, though, that the county board and the coroner's office could agree on that would be necessary to report, in monthly meetings, things that would indeed be meaningful. So like I said, not interested in creating unnecessary work for anybody, but definitely looking for accountability. And it's my understanding that during one of the meetings that I recently listened in on, just to clarify, that board member Frank mentioned that, for the coroner's office to come to the meetings, there is no invitation required. So it sounds like, Howard, you could go at any time and talk to the county board and give them a little additional explanation about what's involved. I know that there was a piece of equipment that was requested by the coroner's office. I believe the cost was about $500,000. That's certainly something that as the coroner or somebody from the coroner's office, I think somebody should be present when requesting for a piece of equipment that is that substantial in cost. My understanding was that a purchasing agent was there to simply defend or talk about that expenditure, and that's not her job. So I think that's an area where there could be improved transparency.
Okay. Last question for everybody. I'm going to give.
I do just have to respond to that.
Sure.
I was actually at those meetings when the transfer was going to be done for that. Whenever anything goes on the agenda that involves our office at the committee level, we certainly do talk to them about it. Once everything passes committee, if they think that it's necessary for us to be at the actual board meeting, then they'll certainly request that we be at the board meeting if there's a question. Whenever those events happen, I do sit in and listen to those. And that $500,000 piece of equipment actually did not come from county money. So that was actually part of the CARES Act. And I was the one that actually put that whole thing together. So I'm very aware of what that is, and I did it all myself from our office. And then, yes, we certainly give it to purchasing because they're the ones that have to, actually they write the checks and they do that. I can't do that part of it. But no, we're very aware. As far as going to the meetings, I listen in on lots of meetings, but no, we're not allowed to speak at the meeting unless they actually ask us to speak because, like I said, I've asked since October to speak at meetings and have been told no. So it's not that you can just go and speak at a meeting. It doesn't work that way.
All right, last question. Ms. Banek, I wanted to give you guys an opportunity, take a minute to wrap up your thoughts on candidacy and why you should be the next coroner. Ms. Banek?
Yes, hi. My name is Jennifer Banek. I'm running for Lake County Coroner. Thank you all for tuning in. I am a longtime Lake County resident. I am a nurse anesthesiologist, and I am a captain in the United States Army Reserves. I have a long-standing history of volunteerism and passion for my community and dedication to its residents. I have advocated for patients since I was a bedside nurse in 2005, and in 2012, when I became a nurse anesthesiologist, I take care of patients from the preoperative time, explaining to them their anesthetic. In the operating room, I am their advocate while they are asleep, and I help manage their pain when they are waking up in the post-operative area. I am an advocate for patients, and I would like to be an advocate for Lake County residents.
Dr. Cooper, an opportunity to wrap up.
Sure. You know, I think that my record speaks for itself. I think we've done a great job in our office. We've brought back things and you know, between annual reports, brought back inquests, we've increased our transparency. We had our office has been accredited, which is a huge deal. And I think that our deputies being boarded is also something that's excellent. It means that we're doing what needs to be done for the citizens of our county. We're making sure that our investigations are done exactly the way they're supposed to be done. And really, you know, I've been treating patients certainly for 29 years in Lake County. I'm a lifelong resident of Lake County. I've been the coroner for 4 years, and in that time, I've been to more scenes than the last 4 coroners combined. I'm out day and night, sometimes all night, and you know, I'm there to help the families. I'm the one that goes to a house and knocks on the door at 3 o'clock in the morning and tells them the worst news they're probably ever going to receive. And I help families get through that time in the best possible way. I mean, certainly when I'm ringing a doorbell or knocking on a door, I realize I'm going to ruin somebody's life. But I think that if we can get them through it in the best possible way and be a resource for them and help them, you know, heal, you know, we're helping with closure, we're helping with certainly investigations, but most importantly, we're there for the families. And, you know, people think that, oh, well, you're the coroner, you just, you know, deal with dead people. But that's not the case. I mean, certainly people that die is part of what we do, but really it's the living that we help every single day. I take calls every day from folks. Our death prevention, I think, has been excellent. You know, I think everything we do and every time we're out in the community, it really, really helps. I went to a scene one night after I had gone to a school and talked to some kids about the coroner's office. And I get to this house and a gal had passed away and her dad was there and he goes, "Are you Dr. Cooper?" And I said, "Yes." He goes, "You know, I knew you were going to come. My grandson told me." I said, "Oh, how did your grandson know I was coming?" And he said, "Because he saw you at school today." And when I went in to talk to the grandson, he said, "You know, Dr. Cooper, I wasn't scared. I knew exactly what was going to happen and I knew you'd be here." You know, that's why I'm here. You know, that's the kind of thing that it's compassion, it's helping people, and that's why people should keep me in office.
Thank you. That concludes today's interviews. I want to thank Dr. Cooper and Ms. Banek for their time and their participation. Good luck on your campaigns. The election is November 3rd. Early voting begins September 24th. That will include mail-in voting this year. We encourage all voters to research the candidates and the issues in all the races and to make use of the Daily Herald and dailyherald.com as part of that research. Ultimately, informed voting is one of the most sacred obligations a citizen has if a democracy is to flourish. Thank you for watching and stay well.
Thank you.
Thank you. Thanks, Howard. Take care.